Hard stool stuck and you can't go. If you've ever sat on the toilet straining with no result, you know how frustrating and uncomfortable it is. You're not alone. Constipation is one of the most common digestive complaints, and a hard, stuck stool is usually right at the center of it. In the next few minutes, I'll break down why this happens, what's going on in your body, and the safest, most effective relief tips you can try at home. And I'll tell you exactly when it's time to stop self-managing and see a doctor. Let's start with the basics. After you eat, food moves through your stomach and small intestine, where nutrients get absorbed. What's left becomes waste and enters the colon, or large intestine. The job of the colon is to absorb water and turn that waste into formed stool. If stool moves too slowly through the colon, it sits there too long. More water gets absorbed, and the stool becomes hard, dry, and compact. That's when you get a hard stool that feels stuck in the rectum. Sometimes it's just a one-off thing. Other times it's a pattern that keeps coming back. The difference usually comes down to a handful of causes. Have you ever experienced poop stuck? Or does someone you know do? Drop your experiences and how you handle it in the comment section. Not enough fiber and water. Fiber adds bulk and holds water in the stool, keeping it soft. If your diet is low in fruits, vegetables, whole grains, and legumes, and you're not drinking enough water, stool dries out and slows down. Low physical activity. Movement helps stimulate the muscles in your colon that push stool along. If you're sitting most of the day or bedridden, things slow down, ignoring the urge to go. Your body gives you a signal for a reason. Regularly holding it in can weaken that reflex over time, making it harder to go when you do try. Medications and supplements. Iron supplements, some painkillers like opioids, antacids with calcium or aluminum, and certain antidepressants commonly cause hard stools. Changes in routine. Travel, stress, pregnancy, and sudden changes in diet can all throw off your bowel rhythm. Underlying conditions. Thyroid issues, diabetes, IBS, and problems with pelvic floor muscles can also contribute. If constipation is new, persistent, or getting worse, that's worth checking. If it's a typical case of a hard, stuck stool, these steps help most people within 1 to 3 days. Step 1. Hydrate. Start drinking more water right now. Aim for 2 to 3 liters a day unless your doctor has told you otherwise. Water alone won't fix it, but without it, fiber can make things worse. Step 2. Add fiber slowly. Aim for 25 to 30 grams per day. Think oats, prunes, pears with the skin, beans, lentils, and leafy greens. Go slow. Adding too much fiber too fast can cause gas and bloating. Step 3. Move your body. A 20 to 30 minute walk after meals helps stimulate colonic movement. Even simple leg movements while seated can help if you're stuck in bed. Step 4. Optimize your bathroom posture. Your rectum isn't a straight shot. Raising your feet on a small stool so your knees are above your hips puts your body in a more natural squatting position. This relaxes the puborectalis muscle and makes passing stool easier. Step 5. Consider over-the-counter options. Stool softeners like Docusate add water to the stool. Asthmatic laxatives like polyethylene glycol or lactulose draw water into the colon. Stimulant laxatives like Senna should be used short-term and sparingly. Always follow the label. And avoid using laxatives daily for weeks without medical advice. Step 6. Don't force it. Straining too hard can cause hemorrhoids, anal fissures, or worsen pelvic floor issues. If nothing happens after the 5th of October minutes, get up, walk around, and try again later. Most cases resolve at home, but some signs mean you need medical attention sooner. No bowel movement for 3+ days with severe abdominal pain or bloating, vomiting, fever, or inability to pass gas, blood in the stool or black, tarry stools, sudden, unexplained weight loss, constipation that doesn't improve after a week of home care. These can be signs of a blockage, fecal impaction, or another condition that needs hands-on treatment. A doctor might do a rectal exam, use an enema, or manually disimpact stool if needed. It's uncomfortable to talk about, but it's routine for them, and it prevents complications. The best treatment is prevention. Keep a consistent routine, eat fiber-rich meals, drink water throughout the day, move daily, and listen to your body when it tells you to go. If constipation keeps coming back, keep a simple log for a week: what you eat, drink, medications, and bowel movements. That log makes it way easier for a doctor to figure out the root cause. Hard stool stuck? It's unpleasant, but in most cases it's manageable. Start with hydration, fiber, movement, and posture. Give it 2 to 3 days. If it doesn't improve or you have red flag symptoms, get checked. Thanks for watching. If this helped, consider saving it for later. And check with your healthcare provider before starting any new supplement or laxative, especially if you have other medical conditions.